Hello, this is Rebecca Pinkham welcoming you to MOL. We have a short payroll and benefits orientation session we've put together for you. This short video explains your pay and benefits as an MOL employee. For the most part, MOL has put together a paperless employee orientation process. You can view the video as many times as you would like. It can pause and go back to replay certain sections as you please. Any information provided here is in summary form. If you have questions about your benefits, jot them down and address them to your HR department's benefits specialist, Heather McCarty. If you have any questions about payroll, you can address those questions to your HR department's payroll specialist, Lenore Baranowski. One of the first things you should know and understand is how you're going to be paid. You will be paid every 2 weeks, every other Thursday. You are paid current, which means that we don't pay you a week behind. For example, let's say the pay date is Thursday, January 21st. On that pay date, you are paid for the work done during the week of January 10th through January 16th, and January 17th through January 23rd. Temporary employees, however, are paid 2 weeks behind. You can be paid via check or direct deposit. If you'd like to enroll in direct deposit, you should do so using the provided paperless direct deposit form. You can put all of your pay into one account or divide it among 2 or 3 accounts. You can review the form later for more details. Even if you get the direct deposit form completed right away, your first pay will be a live check. After HR puts your direct deposit information into the payroll system, they have to do a test run on the next pay date, just to make sure the account information is accurate. For the one pay period, while the test run is happening, you will receive a paper check. HR pays you through an ADP payroll system, and you can access ADP's website to view your pay statements and perform other activities. More information on that topic is included in this presentation, and an ADP registration guide has also been provided to you. Lenore Baranowski will send an email to your MOL work email address when you're able to register on the ADP site. If you work for MOL America as opposed to MOL IT or MOL Bulk, you are responsible for tracking your time and attendance using ADP Easy Labor. You will be notified via email of 2 training videos that have been assigned to you. One video covers how to use our time and attendance tracking tool, Easy Labor, in ADP. If you have questions after viewing this video, your manager or Lenore Baranowski can assist you. The other video walks you through how to enroll in your benefits through ADP. Questions regarding this process should be directed to Heather McCarty. First, have a look through the rest of this presentation and the material you've been provided. The company provides benefit-eligible employees, that is, full-time, regular employees who are hired to work at least 30 hours or more per week with a variety of benefits. Temporary employees and employees who work on average less than 30 hours per week are only eligible for 401k and pension. All other benefits described herein are not applicable. There's a 30-day waiting period on all of your health and welfare benefits, that is, all of the benefits except 401k and pension. During the waiting period, you can enroll in benefits. In fact, you have to. You have 30 calendar days from your first day of employment to enroll in benefits. They just won't be effective until the end of the waiting period. If you miss that cutoff, you won't be able to enroll in benefits until January 1st of the following year. In certain circumstances, which we call qualifying life events, such as marriage, birth of a child, or divorce, you can make a change mid-year, within 30 days after the change occurs. You can have several types of dependents on your insurance coverage: your spouse, domestic partner, or children through and including age 25. If you are also enrolling one or more dependents, you'll need to provide copies of certain information to Heather McCarty just to show that they are in fact eligible. Contact Heather with any questions you may have. Now we will discuss how to enroll in benefits. Within 2 to 5 business days from your hire date, you will be able to register on MOL America's ADP website and our Fidelity Investment 401k site. You will elect all your benefits except 401k and pension through the ADP website. You've received an instruction guide with your new hire materials, which shows you how to register on the ADP site. If you run into any questions or issues, reach out to your payroll administrator, Lenore Baranowski, for guidance. 401k and pension, which is also referred to as profit sharing, have a different waiting period. You're eligible to participate as of the first of the month following 60 calendar days after your start date. So for example, if you're hired on February 12th, you're eligible to participate in the 401k effective May 1st. Enrollment in the 401k and pension is automatic unless you opt out. During the waiting period, you should register on the 401k website at netbenefits.com. Just click the Register Now link on the left-hand side of the page. On this website, you can elect to change your contribution percentage and select the funds you want to invest in. If you do not register or make your elections on netbenefits.com, you will automatically be enrolled at 6% of your pay to go into the 401k, and the money will be invested in the age-appropriate Freedom Fund. These target date funds that offer a mix of stocks, bonds, and short-term investments within a single fund. The mix is based on the expected retirement date that is included in each of the fund's names. For example, the Freedom 2035 Fund is designated for an expected retirement date of 2035. If you are enrolled in the 401k plan through automatic enrollment, you will also be enrolled in the Annual Increase Program. In this program, your contributions are automatically increased by 1% each year in May. You can change the date of this automatic increase or opt out of the program by going to Fidelity's website, netbenefits.com. The company matches your contributions to the 401k plan. The match is 50% of the first 6% of your eligible earnings. So if you earn $50,000 per year salary and your contribution is 6% to the 401k or $3,000, the company kicks in another $1,500. In addition to the 401k match, the company has this really great pension benefit. You don't have to contribute anything. In fact, even if you're not a 401k participant, you still get the pension. So if you earn $50,000, the company gives you $2,500 or 5% of base salary as pension. When you factor in the 401k match and the pension, the company is contributing quite a bit towards your retirement investing. 401k match vests in thirds over the course of 3 years. So after 1 year of service, the match funds are 33% vested. After 2 years, they're 67% vested, and after 3 years, they're 100% yours. The pension vests all at once at 3 years. So if you leave the company before you've been here for 3 years, you do not receive the pension that you've accumulated. If you have an old IRA, 401k, or 403b account, you can most likely move those funds to your MOL Fidelity account. If you want to do so, please contact Heather McCarty for more information. If you have any questions or issues with netbenefits.com or with the 401k or pension in general, reach out to Heather McCarty. If you are a full-time regular employee, you can enroll yourself and your eligible dependents in medical, dental, and vision plans that I'm about to describe. There are 3 medical insurance plans, all through Cigna, and they include prescription coverage as well. You cannot purchase just medical coverage or just prescription coverage. They're tied together. Human Resources can advise you which plan to choose. Each plan has its own appeal, advantages, and trade-offs. We will give a narrative summary of each of the plans and then provide some finer details. Option 1 is the OAP In plan. The In part means in-network only. This plan has the lowest deductibles and out-of-pocket maximums of the 3 plans. The downside is you're only covered with healthcare providers within the Cigna network, so if you see a doctor outside of the network, the claim would not be covered. Option 2 is the HRA plan. HRA stands for Health Reimbursement Account. The plan has the lowest premium cost, or in other words, the lowest amount deducted from your paycheck. It also features in-network and out-of-network coverage, unlike the OAP In plan. The HRA plan has the highest deductible, $1,500 for single coverage, which means if you have to go to the doctor or have any medical procedures done, the plan isn't going to pay for anything until you spent $1,500 out of pocket. To help ease the risk, you've been given a health reimbursement account by the company to pay for some of the out-of-pocket costs. Single enrollees get $500 HRA accounts. The others get a $1,000 account. This type of plan, sometimes referred to as a consumer-driven health plan, because the cost can potentially be very low if you don't go to the doctor often. But the cost can escalate steeply if you find yourself going to the doctor often. Remember, the plan does have an out-of-pocket maximum. That's a maximum amount you would have to pay on eligible expenses until the plan begins paying at 100%. The out-of-pocket maximum for single coverage is $3,000. Option 3 is the OAP plan. This is what some would call a very traditional plan. Most companies that offer benefits have a plan structured similar to this. It has in-network and out-of-network coverage, a relatively low deductible, but out-of-pocket maximums are close to or higher than the HRA plan depending on the coverage level you select: employee, employee plus one, or family coverage. If you're interested in enrolling in medical insurance, you can enroll via the ADP site. The wellness program encourages healthy living by providing an incentive for participating in a variety of wellness activities. You earn points towards a reduced medical premium by completing a biometric screening and personal health assessment. Plus, you can participate in several other activities such as preventative screenings, seminars, health coaching, and wellness challenges. If you are hired on or after April 2nd, you will be able to start earning points in August towards the next year's incentive payment. As part of the wellness initiative, the company is committed to being a tobacco-free workplace. If you are a tobacco user, a surge charge of $20 per month will be added to your medical premium. To incentivize you to quit using tobacco, the surge charge is waived if you're participating in an approved tobacco cessation program with our medical provider, Cigna. You must sign up for the program within 30 days of enrolling in a medical plan and be actively participating in the program to receive the waiver. Dental insurance is also provided through Cigna. There's only one plan available to our employees, so there's nothing that you'll need to compare side by side. Coverage includes 2 exams and 2 cleanings per person per calendar year. The plan provides benefits for basic and major restorative care and orthodontics for dependent children under the age of 19. If you would like to enroll in dental insurance, you can enroll via the ADP site. Vision insurance is provided through a company called iMed. It is a $10 copay for an annual eye examination. You get eyeglass lenses once per year and frames every 2 years. Contact lenses are heavily discounted. If you're interested in enrolling in vision insurance, you can enroll via the ADP site. This page describes what you'll pay in terms of premium costs or payroll deductions for medical, dental, and vision insurance. As you see here, you can enroll yourself or add one or more eligible dependents to these plans. Flexible spending accounts, or FSAs, are a useful way to save money for your medical expenses or dependent care expenses. You decide an amount that you want to put in the FSA for the year, and it is deducted pre-tax from your paycheck, so you save on your tax liability. There are 2 kinds of FSAs. Healthcare FSAs can be used for out-of-pocket medical expenses incurred by you and your eligible dependents. The calendar year limit you can put into a healthcare FSA is $2,550. If you anticipate having surgery or having a child during the year, a healthcare FSA can be a good way to save on your tax liability for that year. Dependent care FSAs can be used for daycare, preschool, and elderly care. The calendar year limit you can put into a dependent FSA is $5,000. FSAs are great for tax savings, but there also are some risks involved. If you don't use all of the funds you allocate for a calendar year, or if you missed a deadline for submitting FSA claims, you'll lose out on those funds. So there's some administration and record keeping involved. It's use it or lose it. If you're interested in enrolling in an FSA, you can enroll via the ADP site. The company purchases life insurance and accident insurance for you at no cost to you. You get the equivalent of your salary up to a maximum of $50,000 for both life and accident insurance. Enrollment is essentially automatic, but you'll need to fill out a beneficiary form which has been provided to you, so we can tell Cigna who would be paid out in the event of your passing or serious accident. In addition to the free company-funded life and accident insurance, the company also offers you the option to purchase additional life and accident insurance to cover yourself, your spouse, and/or children. It is not something you need to enroll in on the ADP website. If you happen to be interested in this, please contact Lenore Baranowski for more information on how to enroll. The company provides short-term and long-term disability. Short-term disability is when you're out anywhere from 1 to 26 weeks for illness or injury. Long-term disability covers anything beyond 26 weeks. Coverage is automatic. You do not need to take any action to be covered for disability. In the event you ever have things happening in your personal life, which you wish not to discuss with family or friends, you have access to an employee assistance hotline. This is provided by Cigna and is of no cost to you. The information you share is kept confidential and is not reported back to the company. There are policies on the company's intranet site regarding all forms of paid time off, but in general summary, the company gives paid days off for 10 holidays per year. Employees also get 2 floating holidays each year, prorated based on your hire date. In 2016, there will be 9 set holidays and 3 floating holidays. Sick time is unlimited for exempt salary employees, and non-exempt hourly employees get 6 days per year. Vacation time starts at 2 weeks per year and increases the longer you've been with the company. If you have jury duty or need to take time off due to the death of a close relative, the company also pays for those days as well. The company also covers some of the costs of continuing education. There's a full policy on this, but in summary, you can get 80% of your costs reimbursed, up to $4,000 per calendar year. Lastly, the company offers a number of discount programs on things ranging from automobiles to mobile phones. All of this information is on the Human Resource section of the company's SharePoint intranet site, which you will be able to access on your first day of employment. This site contains employee policies, organizational charts which show you who's who in the company, and some of the benefits information that have been described in this video.